Picture this. You're at the playground and you notice your toddler walking around on their tippy toes, like a tiny little ballerina. It's adorable, right? But then you start wondering, is this normal? Should I be worried? And why does my child keep on doing this? We're diving deep into the world of toe walking in toddlers, and I'm going to share everything you need to know to help your little one walk confidently on their whole foot. If you're new to my channel, my name is Cherrick Gordon. I've been a pediatric physical therapist for over 25 years. Welcome to the BabyMasterPT podcast, where I show proactive parents like you how to use simple touch and movement to help your baby catch up and move ahead. I've worked with hundreds of families navigating the sometimes confusing world of childhood development. And today we're talking about toe walking in toddlers. So grab a cup of coffee, get comfortable, and let's talk about what toe walking really means, when it's totally normal, and when you might want to check in with your doctor. First things first, what exactly does toe walking look like? Well, when a child is toe walking, they're walking on the balls of their feet or up on their tippy toes instead of putting their whole foot flat on the ground. Imagine walking around your house on your tippy toes all day. That's what these kiddos are actually doing. Now, here's the thing. Most children who are just learning to walk will try out a whole bunch of different positions with their feet and their legs. It's kind of like they're little tiny scientists experimenting with their bodies. They might walk with their feet turned inwards one day, bow legs the next, and yes, sometimes they'll pop up on their tippy toes if they're reaching for something. This is completely normal when they're first learning to walk. As a matter of fact, toe walking is completely normal before the age of 2. If your kid is 2 years old or less, they will sometimes pop up on their toes. In fact, many kids will toe walk occasionally when they're cruising around the room, exploring their environment. It's part of their movement toolkit as they figure out this whole walking thing. So why do toddlers toe walk? Let me break down the most common reasons. First, when children first start learning to walk, they try different positions. Think of it like learning to ride a bike. You wobble, you adjust, you try different things until you figure out what works. Walking for your baby is the same way. They have to practice, they have to get their body swaying side to side and moving around and figuring that out. Most kids toe walk occasionally when they're cruising around the room. They're not doing it constantly. They're just trying it out. It's playful, it's exploratory, and it's usually no big deal. Third, some kids keep toe walking off and on just for fun. Maybe they like how it feels, or they're pretending to be a dancer or their favorite character. It's part of imaginative play. Now, here's an important point. What does toe walking indicate when it becomes more than just occasional exploration? Persistent toe walking can sometimes indicate that a child has tight muscles in the back of their legs, tight heel cords, or what we call the Achilles tendon. When these muscles are tight, it makes it harder for the foot to come down flat on the ground, so the child stays up on their tippy toes. So, the question at the back of your mind should be, when should you be concerned? At what age should a child stop toe walking? Here's what you need to know. You should consult your doctor if your child is walking on their tippy toes more than 50% of the time, or walking on their tippy toes all the time. If your child is constantly up on their toes throughout the day, that's worth checking out. Or if you notice your baby is only toe walking on one side, if one foot stays flat and the other is always on tiptoe, that's definitely something to mention to your pediatrician. If your baby is unable to stand with their heels on the ground, for instance, if you take your hands, put your hands on your baby's hips while your baby is standing and cue them to bring those heels down on the ground, and you notice that your baby cannot come down on their heels, that's something to be concerned about. It means that their heel cords are too tight. If toe walking is causing difficulty with activities, if your baby is having trouble running, jumping, or keeping up with other kids their age, that's a red flag. if your baby's up on their tippy toes and it's causing them to lose their balance. Now, let me address another question I get asked frequently. Is toe walking ADHD or autism? The answer to that question is, it depends. Toe walking can be associated with various developmental conditions, including autism spectrum disorder and ADHD. But it's definitely not a definitive sign of either of those conditions. Many children with autism or ADHD don't toe walk. Many children who toe walk don't have autism or ADHD. It is one of those things that we pay attention to, and we take that into account, put it in a cluster of other signs and symptoms before we move towards a diagnosis of ADHD or autism. Toe walking is just one piece of the puzzle. If you're concerned about your child's development beyond just their toe walking pattern, talk to your pediatrician about a more comprehensive evaluation. So let's talk about why and when toe walking is a red flag. Why do doctors and therapists pay attention to persistent toe walking? When a child toe walks consistently, it can lead to several problems over time. First, it can create or worsen tight heel cords. The more a child walks on their toes, the tighter those calf muscles become. Second, you might notice bowed legs when they start walking. The body tries to compensate for being up on the toes, and this can affect how the legs develop and align. Third, their feet turn inward. This positioning affects the whole lower body from the hips down to the feet, and persistent toe walking can affect balance, coordination, and how a child runs and plays. Think about it. When you're always on your tippy toes, you don't have the same stability as when your whole foot is on the ground. The good news, when we catch toe walking early and address it, we can often prevent these longer-term issues. Now let's talk about what you can do at home to help your baby. I'm going to teach you a specific stretch for tight heel cords that you could do with your baby or toddler. This is the same stretch that I teach parents when I go to their homes every single day. I'm going to walk you through step by step how to do this stretch. So let's assume and pretend that you're stretching your baby's right heel cord. Here's what you're going to do. Step 1, sit down comfortably with your baby on your lap, facing away from your body. Make sure that you're both relaxed. Step 2, take the index finger of your right hand and place it behind your baby's right knee. Gently bend your baby's right knee. Why are you doing this? Because bending the knee relaxes the calf muscle, which makes the stretch more effective and more comfortable for both you and your baby. Step 3. Now use your left hand to hold your baby's right foot. Make sure that you have a gentle but firm grip on the whole foot. And then what I want you to do is, step 4, this is a key movement, gently move the right ankle joint as if you're trying to bring the toes up to touch the right knee. Keep that right knee bent while you do this. You should feel a little bit of resistance, but your baby shouldn't be crying or pulling away. If they are, ease up just a little bit. Step 5, once you have the foot in that position, with the toes pointing up towards the knee, I want you to slowly straighten the right knee while keeping the toes pointed up towards the knee. Now you're actually stretching your baby's right heel cord effectively. I like this position because in this position, you can gently rock your baby side to side and comfort your baby as you're doing this stretch. You want to hold this stretch. A lot of parents ask me, how long should you hold it for? Keep this stretch going for about 1 minute or as long as your baby can tolerate it. If your baby is fussy, even 30 seconds is better than nothing. Now you can work up to longer stretches as they get used to the stretching. I recommend doing this stretch at least 3 times a day, maybe during diaper changes, after naps, or during playtime. Here's a pro tip. Make it fun. Sing songs, make silly faces, or have a favorite toy ready to distract your little one. The more relaxed and happy they are, the more effective the stretch will be. And remember, you'll repeat this whole process on the left leg too, just switching which hands you use. Here are a couple of additional tips. Beyond stretching, here's some other things you can do to encourage proper walking. Encourage barefoot time. When children are barefoot, they're more likely to walk with their whole foot on the ground. Let them walk barefoot on different surfaces: grass, sand, carpet, tile. This helps to develop the muscles and sensory awareness in their feet. Make a game of flat feet walking. Show them how to walk with their whole foot on the ground and make it fun. Avoid pushing your child in a baby walker for too long. Walkers can sometimes encourage toe walking and are recommended for safety reasons as well. You can also try choosing supportive shoes. When a child does wear shoes, make sure they fit well and provide good support. Here's what I want you to remember. Most toe walking in toddlers is completely normal and will resolve on its own as they get stronger and more confident in their walking. Your child is learning and exploring, and that's beautiful. However, if your child is toe walking more than half the time, or if it's only on one side, if they can't stand with their heels down, or if it's affecting their ability to play and move, reach out to your pediatrician or pediatric physical therapist. The stretches I taught you today are safe and effective, but if you're ever unsure if your child seems to have significant tightness, definitely consult with a professional. We're here to help, and early intervention can make a huge difference. Now remember, every child develops at their own pace. Your baby is unique, and what they need might be different from what other playmates or siblings need. Trust your instincts as a parent. You know your child best. Thank you so much for spending this time with me. Don't forget to like, comment, and share this video if you're watching it on YouTube. If you have any questions or topics you'd like me to cover in the future, I'd love to hear from you. Drop them in the comments down below. I'll talk to you soon. Take care. Bye-bye.